Why 2026 is the year you must see a dermatologist. Here are some signs that you need to visit and what to expect. If you've been putting off seeing a dermatologist, 2026 is your wake-up call. The skin damage from the past few years is about to show up, and waiting longer could cost you your health or your life. Hi everyone, I'm Dr. Weinstein. I'm a board-certified dermatologist, and I'm seeing more skin cancers, premature aging, and preventable damage than ever before. Today, I'm telling you exactly what you need to see a dermatologist for and what's happening in 2026 that makes it urgent. Here's what's happening that makes 2026 the tipping point. The pandemic skin damage is surfacing. What this means is we've been noticing 3 to 5 years of delayed skincare and therefore erupting signs of sun damage. There also have been more stress-related skin conditions that are on the rise. Mask acne and barrier damage are now becoming chronic, and a lot of people are trying to catch up on all their delayed medical care. There's also that piece of the age acceleration. So people who started skincare late are now seeing rapid skincare changes and trying to reverse that damage little by little. Sun damage from your 20s and 30s is appearing now, and hormonal changes are hitting harder without professional help. Here's a real patient example. So I had a patient named Lisa. She ignored a changing mole for about 3 years. What started as a simple removal for a biopsy became a melanoma, which is the most life-threatening form of skin cancer, which then required surgery and ongoing monitoring. What's great about skin is it's something that you can see. Everybody can see changes happening on the skin. And so something like melanoma, when caught early, is totally curable. But when gone too long, it can lead to severe life-threatening changes to your skin and your overall health, and eventually even death as a worst-case scenario. Here are some urgent signs that you need to see a dermatologist now. These signs mean to book an appointment immediately and don't wait. So there are some skin cancer red flags. If you're developing new moles or spots after the age of 30, if you have existing moles that are changing size, color, or shape, if you notice spots that bleed, itch, or just won't heal, or if there's a family history of melanoma. In dermatology, we recommend monthly self-skin checks. This is a way that you can keep track of skin changes on your own at home in the comforts of your own bathroom. The things you should be looking for are called the ABCDEs of melanoma. So A means if you have a mole and it's asymmetric and one side doesn't look like the other, this is a telltale sign that something could be going wrong with that mole. B means border. So if that mole was previously perfectly round and now it has jagged edges, that again is a reason to seek help from your dermatologist. C is color. So if the mole was originally brown and now it's sort of changing red, or it's losing color, or you're noticing black spots, again, red flag, you need to see a dermatologist. D is diameter. So if the mole is over 6 millimeters large, so if it started small and it grew to over 6 millimeters, which is about the size of a pencil eraser, this is another reason to come in to your dermatologist or even your primary care doctor as a start. And E stands for evolving, which means that the mole looked a certain way initially, and over the years it's been evolving into something that looks completely different. Again, reason to come in. So easy to remember, ABCDEs of melanoma. And again, do your monthly self-skin checks in the bathroom after a shower. If you can't look at your back, maybe get a handheld mirror and look over your shoulder, or have your spouse or a child or somebody else in the house help you to monitor signs for changing moles on your back. Now, another reason to come into the dermatologist right away is if you're developing acne that's been out of control. So cystic acne can cause scarring in the long term. And so if it's painful and if you're already noticing those signs of scarring, definitely come in and seek some treatments, or at least some recommendations for treatments that you can get started on right away. If you're an adult over the age of 26 and you have acne that started all of a sudden, and it's not only involving your face, but it's your back and your chest, definitely come in. If you've tried over-the-counter treatments and they're not working at that 12-week period, then come in to seek further help. Or if you have acne that's actually affecting your mental mental health. This is not uncommon. If you're feeling depressed or socially withdrawn and you don't want to face the public, if you feel like you have to wear a mask to cover up your acne, definitely come in. There are such great advanced treatment options now that can help, whether you're into taking medications orally, topically, or using energy-based devices. There are tons of options for all of those treatment concerns. Also, if you have aging concerns, so deep wrinkles that are appearing rapidly, significant sun damage or dark spots, if you're noticing skin textural changes or sagging, or just want professional prevention and not necessarily correction, these are great reasons to come into your dermatologist and things that we can help you with in 2026. Now, if you suffer from chronic skin conditions like eczema or psoriasis and you have a treatment regimen, but it's been flaring rapidly and frequently, then something might be changing with your condition, and that's a good reason to come in and see your dermatologist. If you notice that your rosacea is getting worse, or you're starting to develop persistent rashes or irritation, or if you notice that you're losing a lot of hair or notice hair thinning, these are all reasons to come and see your dermatologist. If you need to start with your primary care doctor and get a referral, then that's the route to go through so that we can help you combat these issues before they get more severe. That something's not right feeling is so important to listen to, so trust your instincts. If something looks or feels different, get it checked. Now, if you've never been to a dermatologist, that first visit can be pretty scary, so let me give you a little insight on what to expect. Here's exactly what happens. So typically we start with a full body skin exam. We'll have you undressed, you can keep your undergarments on, and we'll give you a robe. It takes about 10 to 15 minutes. We check every mole, every spot, and every area, and we use the device called a dermatoscope to examine your skin. So it's a little magnifying glass, and we can use this to assess small moles in the area. We kind of look through it. It gives us particular patterns of different lesions on the skin, and we're able to evaluate those patterns and determine whether or not that spot might require a biopsy. Now, during the consultation, we'll discuss your main concerns first. We typically review your family history for skin cancer or melanoma history, or any sort of skin condition or skin history that's important to gather. And we also take a list of your medications, noting that if any medications cause pigmentary changes on the skin or photosensitivity, it's important to document all of that as we're taking our full assessment. Next, we create a treatment plan together and discuss our best plan of action for all of your concerns. And then we'll definitely wrap it up with product recommendations that are specific to your skin needs. Now, there are some common procedures that dermatologists do in the office if needed. We often will biopsy the skin if there's something that looks concerning, or if it just doesn't look right under the dermatoscope, or if you came in for a spot check specifically, it's easy enough for us to biopsy it the same day. The biopsies are quick, they're minimally painful. We use a little bit of lidocaine to numb the skin, and before you know it, the spot is gone. We send it to the lab, and our dermatopathologist will look at it under the microscope and let you know what those cells look like under the microscope. If we remove moles, again, it takes about 5 to 10 minutes. We do numb you prior to the procedure and get you really comfortable, and the mole removal does not take long at all. It's actually a very easy, quick process and can be done the same day as your visit in most situations. If you have cystic painful acne, we can inject those cysts with cortisone. Again, quick and easy to do, and those injections provide almost immediate relief. If not within the next 24 hours, that swelling and inflammation should go down. And like I said, most treatments are done the same day, and the visit can be really quick and efficient. Now, here are some pro tips on what to bring to your dermatologist appointment to get the maximum benefit out of those short few minutes with the doctor. Bring a list of your current skincare products. If you don't want to list them out, pile them into a bag and bring them into the office to show us in real life. Also, if you've been photo documenting spots on your skin and noticing different changes, you can always bring in those photos to show us how things have changed over time. And if you came in for a rash and the rash is no longer there, but you have photos of it, we would love to see that, because if nothing is on your skin currently, it's hard for us to diagnose and make recommendations moving forward. So always document the changes that are going on in your skin, because you never know at that time when you see the dermatologist, they might be fine and gone, but then you might develop it later on, and we just missed that time period of when whatever it was flared. Now, of course, bring your insurance card and ID, and if you have any specific questions, it's nice to write those down so that you come prepared, and again, you're able to maximize that time spent with your dermatologist. Now, I had a patient who came in and said that, she was terrified of her first dermatologist visit, but it was easier than going to the dentist, and I do hear that all the time, and we were able to catch a precancer that could have become more serious, and that's something we do all the time. Thorough examinations, take biopsies, check for precancers, and if we see those, we can treat them at the time of the visit to prevent something worse further down the line. Here are some tips on what you can do to maximize your appointment with proper preparation so that we can utilize our time efficiently. Before the visit, make sure you remove all of your makeup and nail polish. We are experts in hair, skin, and nails, so we definitely take a look at your nail beds as part of our full exam. It's also super helpful if you avoid self-tanner at least 2 weeks prior. That way we get a realistic view of what's on the skin and we don't have to look underneath the tanner or wipe it off with alcohol swabs to really see what's going on. Again, write down all the skincare products you use and take pictures of changes on the skin so that we can see them in the office. Here are some questions that you might want to ask your dermatologist. What is my skin cancer risk? Knowing that maybe nobody in the family has had skin cancer or a parent had skin cancer, that's something that is definitely fair to ask. And you can also ask, how often should I get skin checks? Typically, if you've had skin cancer in the past, then we recommend yearly skin checks. If something pops up sooner, we can see you at that time for a quick spot check. Now, if you've had melanoma in the past, then of course we see you more frequently, and that's a discussion between the dermatologist and the oncologist. Now, moving away from the skin cancer checks, we can also talk about skin care. So what's the best skincare routine for my specific skin type? We can go into that during your office visit and also point out any concerning spots that you should watch, whether it be on your face or on your body. Now, here's just some insider knowledge, and it's important to know this before coming in because dermatologists can do both medical and cosmetic procedures. So there might be some things we do that insurance covers, and there might be some things we do that insurance doesn't cover. And it's important to be aware of those things before you come in. So typically, insurance will cover medical concerns like moles, acne, rashes, biopsies, any skin cancer concerns, your skin check. Those are usually covered. But cosmetic treatments like Botox and fillers are not covered. Even the simple, non-threatening things like skin tags or benign growth removal like seborrheic keratoses, these things might not be covered, and often there is an out-of-pocket charge, or in our office we call it a cosmetic cleanup charge, where we can take care of all these benign growths on the body, knowing that if we build it through insurance, it just might not be covered. Now, just like with any office visit, timing matters. So if you are looking to see a dermatologist in the next couple months, make sure you call ahead so that you're not waiting 6 months, a year for that appointment. Dermatologists, just like a lot of physicians these days, have busy, jam-packed schedules, and so it's really important to be proactive and plan ahead for that visit because more than likely you won't get a visit the next day or even the next week. It's also important to avoid scheduling before vacations because if they need to do a procedure like a biopsy and we are, cutting through the skin, usually you don't want to be swimming for the next 2 weeks if there are open areas on the skin or in any super sunny place where you're prone to get a tan or even get a burn. So make sure you plan your dermatology visits and procedures around your vacations. Now, here's why professional skincare beats DIY skincare. We're able to offer prescription treatments and combine those with over-the-counter treatments. So there are prescription retinoids, for example, like tretinoin, which are about 100 times stronger than over-the-counter retinol, and therefore they're more effective. Now, they're not always the right product to start with, and they're not appropriate for everyone, but we are able to offer prescription strength at least to give it a try, and then you can get over-the-counter recommendations from there if you're not tolerating. We're also able to supplement your over-the-counter acne regimen with prescription acne medications that actually work as well. Like I said earlier, if you're struggling with cystic acne or inflammatory acne or new acne and you've tried all of these over-the-counter products and they're not working, prescription products can be super helpful to supplement with your over-the-counter products to really get a handle on those acne breakouts. We're also able to prescribe lightening ingredients like hydroquinone for stubborn dark spots and antibiotics or oral treatments for stubborn breakouts and stubborn rashes. There are also a whole host of in-office professional treatments that dermatologists can do, such as chemical peels that tend to penetrate deeper than topicals at home. There are laser treatments that we do for sun damage and scarring, microneedling with professional grade devices, and injectables like Botox and filler for aging prevention. And I encourage you to check out some of my other YouTube videos where I delve deeper into each of these individual treatments for individual skin needs. Dermatologists are also able to provide accurate diagnoses, so we can distinguish between different acne types for proper treatments, whether it's hormonal acne or it's a hygiene issue or a dietary issue. It's really important to tease apart what the root cause of these acne breakouts might be. And sometimes what you read online or what you see on social media is not always accurate because these influencers are not necessarily credentialed. And so it's important to fact check with board certified dermatologists so that you can really weed through what information is accurate versus hype. We also help you identify skin cancers versus benign spots. We can take a lot of that worry away, in addition to diagnosing conditions like rosacea versus just sensitivity. And at the end, the real icing on the cake is we can customize treatments for your specific needs. There's also a huge focus in healthcare in general, as you probably know, on prevention. So our goal as dermatologists is to catch problems before they become serious. We talked about catching active acne before you develop scarring. We talked about identifying pre-cancer so that they don't become more severe over time and turn into full-blown cancer. We are here to create long-term skin health plans and monitor changes over time. And then we can adjust our treatment recommendations as you age. I had a patient named Mark who spent 2 years trying drugstore acne products. He had one dermatologist visit and got prescription tretinoin, and it cleared his acne within 3 months. Now, this is a success story, but it's not everybody's story. So it's important to make sure that you don't hesitate, reach out to your dermatologist to help you fine-tune your skincare routine. Now, what you might not realize is delaying dermatologist visits actually costs more than just money. There are serious health consequences that can ensue, like skin cancers that are caught late and then require major surgery, acne scarring that becomes permanent and then requires a lot of money down the line to pay for lasers to help reverse the scarring. There are chronic conditions that worsen without treatment, leaving your skin chronically damaged, and there are preventable aging changes that, when addressed early, can be reversed. The financial reality of it all is that you save money by taking the preventative approach, because early skin cancer removal could be about $200 to $500 depending on what your insurance covers or does not. Now, if you have the unfortunate circumstance of having advanced melanoma, it could run you up to $100,000 in the long run. And so prevention is key here. Preventing acne scars versus investing thousands of dollars in expensive surgeries down the road. Now, as you know, skin is the largest organ of the body, and not all skin conditions can be hidden because skin is visible to everyone. And so, as you might imagine, in dermatology, there's a huge quality of life concern when skin conditions go untreated. We see a lot of confidence issues from untreated skin problems, pain from chronic conditions, anxiety about changing moles or spots, and regret about preventable damage. The 2026 urgency is that skin damage compounds over time. What you ignore today becomes tomorrow's major problem. 2026 isn't just another year. It's when the skin damage from delayed care, pandemic stress, and aging acceleration all collide. Don't be the person who waits until it's too late. Your skin is your largest organ and deserves professional care. Whether it's prevention, treatment, or peace of mind, seeing a dermatologist this year could literally save your life. When was your last dermatologist visit? Drop a comment and tell me what's been stopping you. And subscribe, because I'm sharing more insider tips on getting the most out of your dermatologist visits.